Hey everyone, while age may be the overall leading risk factor for developing atrial fibrillation, preventing AFib involves addressing modifiable risk factors that contribute to its development. Let's review these 10 factors. Hypertension, high blood pressure, increases left atrial pressure and size and is the most important modifiable risk factor for developing AFib. Obesity, excess weight, increases atrial size, inflammation, and fibrosis. Sleep apnea, otherwise known as obstructive sleep apnea or OSA, causes intermittent hypoxia, pulmonary hypertension, increasing atrial strain and triggering arrhythmias. Diabetes, while poorly controlled blood sugar, contributes to remodeling and oxidative stress. Excessive alcohol consumption, well, remember that both chronic and binge drinking, often termed holiday heart syndrome, increases the risk of AFib. Physical activity, or rather inactivity, well, sedentary lifestyles contribute to obesity and other metabolic conditions that increases the risk for AFib. Smoking, well, smoking increases oxidative stressors and inflammation. Well, enough said about that. Nobody should be smoking anymore. Diet, poor diets, high in processed foods and low in nutrients contribute to cardiovascular risk factors. Thyroid dysfunction, while both hyperthyroidism and hypothyroidism can trigger AFib. So if you have been diagnosed with either, make sure that you are compliant on your medication. And lastly, high salt intake. High salt consumption exacerbates hypertension, which, remember, is the single most important modifiable risk factor for developing AFib. So by managing these modifiable risk factors, individuals can significantly reduce their risk for developing atrial fibrillation or its recurrence after treatment has begun.